Hello, everyone, and welcome to today's edition of Nick's Notes. I am thrilled to have two incredible women who have become friends. They actually contacted me for advice on their startup, and they're so brilliant, I ended up picking their brain for advice on my startup. Alison Greenberg and Audrey Wu from Ruth Health. Welcome to the program, ladies.
Thank
Hey
you,
Nick,
Nick.
thanks for having us.
So tell me, Allison, you went to Yale and you famously say in your bio that you grew up talking about vaginas, right? And Audrey, you went to UCLA, you worked at places like Reliance. How did you two meet and come together to start a company in the first place?
Well, let's rewind to our previous careers before moving into what's called, I guess, femtech. Elson and I met in the space of conversational AI. I kind of fell into it, 2015, building chatbots and voice experiences, and then ended up building a SaaS company called Converge, which I exited to Reliance Geo in 2019. And Elson and I actually met on a panel.
The Fembit Festival
Yeah,
in LA, in
yeah.
your native LA. Yeah, a good friend of mine invited me to speak. Both of us were speaking on a panel of women in conversational and broader AI. And at the time, I was running a conversational AI studio called Aflow, based in New York City, where I live now. And basically, we were the two loudest people on the panel. We got the most audience feedback.
We got a lot of good feedback.
Yeah,
You and Allison were great. You
yeah,
and that girl, because Allison actually beamed in. She wasn't even in
yeah,
LA, so she was
Yeah,
a gigantic head.
I was like on a big screen. Audrey was there in person with everyone else, but somehow through the digital divide, we hit it off, and it makes a lot of sense because that's kind of when we became friends, colleagues, started working together in the space, and then Audrey would come to New York, we'd get dinner. I'd go to LA, we'd get dinner. And actually, one night at the Soho House in West Hollywood, this is the famous
yep,
origin story of Ruth Health. We're in a group of several women, and everyone's complaining about their experiences at the OBGYN.
yep.
So this is of particular interest to me because, like you said, I grew up talking about vaginas at the dinner table because my mother is an OBGYN.
Wow.
So
And also our chief medical officer, so
yeah,
Dr. Viv.
yeah, Dr. Viv has gotten roped into this company,
Yeah,
although she's trying very hard to retire. And she was sort of the inspiration for our initial work together. In that conversation, people complained about particularly the tools of the trade,
yep,
the speculum, all the things that are used in a pelvic exam. And Audrey and I left that dinner saying, like, we've never designed a medical device. We have no right to do
yeah,
this. We think we can do better.
yeah,
And so Ruth Health was actually not our first company together. Our first company together still exists. It's called Dioptra. And we invented a more comfortable, patent pending, 83% cheaper to clean speculum cover device.
And
right.
it's actually been funded by the FDA twice. So we actually were able to hire a real life medical device design
Right.
company to build something that's not out of our brain. So it's coming out to be super cool. We're really excited. And
Wow.
so as Alison mentioned, that was our first product, and we realized hardware's hard, very hard.
Yes,
So we thought, okay, well, people that actually want this device are the end user, us,
yes,
the women. And practitioners don't really care. So the idea of Ruth was initially like maybe we build our own practice to use better tools. But that is not really like an
yeah,
annual appointment. It really kind of happens like biannually now. So it wasn't high volume.
And
right.
so Ruth Health was sort of a pivot off of Dioptra, but it truly sort of catalyzed in Grid 110, amazing LA-based accelerator. We're like deep in the pandemic. This is deep,
Yeah,
deep COVID quarantine days. And we were participating in Grid 110 as Dioptra. Mickey Reynolds gets a huge shout out, managing director of Grid 110, which is funded by Brad Feld, the city of LA, Mayor Garcetti's office. We had this aha moment. Like, this device is important, but there's much bigger fish to
yes,
fry in women's health. How can we use our experience in conversational AI to make the highest volume care moment in a woman's
right,
life, pregnancy, easier?
right.
And, I call up my mom. I'm like, I have this crazy idea. What about like a house calls business that
Yeah,
also has a telehealth clinic component of it? And we kind of hit the ground running in May of
right.
2021 when we saw our first patient.
Yeah.
That was an at-home ultrasound that we did in Brooklyn for a celebrity. It went viral, got 2 million hits on Instagram and Twitter,
And
and
off to the
then
We got
races.
got
Yeah,
into Y
And then we
Combinator.
got to Y Combinator, and then Y Combinator has a very much like, break things and
yeah,
build fast, but you can't do that with healthcare. So we were like, they're telling us, what can you do in 2 weeks? What can you launch? And like, not a medical practice. So like, we had to think through different ways to actually be able to launch. And
Right.
so we came up with this pelvic floor recovery service, which is taking more of a fitness approach. So therefore, the red tape is, a lot less.
Right. Right. Well, look, I think the founding story is phenomenal. I think the product in the space is phenomenal. My wife and I, who work together, as you know, and she's a Renee, and hey, Renee is my wife, and
Yes.
we've had 3 kids together. And the first time I ever went to an OBGYN's office as a man was with my wife when we were trying to have kids. And I saw that speculum thing, and I was like, a man would literally never allow this to happen, period. Like it would
Yeah.
literally, the
We always
species
said that,
the
Nick.
species would be extinct. No man has the courage to do this. End of discussion, right?
You know
And
there's an anal speculum.
huh? Sorry,
There's an anal speculum.
I'm just
Yeah,
When
and
uncomfortable.
we, when we filed for the patent, our device is patent pending, we had to check anal speculum, nasal
Yeah,
speculum. So it's so funny you say that.
don't Google it. You're going to be
yes.
really
Men,
upset.
I don't want to.
did
Trust.
not encounter a
Yes.
vaginal speculum, but you're right. It
Right.
was designed by a man who abused women of color in the 1850s.
Yeah.
It's a torture device. It's
Yeah.
a literal torture
Yeah.
device.
It literally is.
And so
And
we did so much research on that, and then we did more research into the state of women's health in the United States right
right.
now, and maternal mortality was just shocking.
Yeah. And for those that listen to this podcast, you know we've talked about this before, right? That maternal fetal mortality is a measure of a society's progression. And in America, we have a unique situation because most countries have a maternal fetal mortality rate. Okay. The best countries in the world around 5, some of the worst countries in the world around 50. But they're generally in that country, that's the rate. The United States of America, if you're in Los Angeles, California, that number is 7. If you're in Texas, that number is 35, right? And so this is an issue, unfortunately, because of the patriarchy of male driven politics in America. It is an issue that has taken on political flavor. Women's health is affected by politics, men's health is not, right? And it shouldn't be. But the thing I want to talk about with Audrey and Allison, and I want to say because they weren't first time entrepreneurs, but they approached me because I had Heal and a house call company to help. And I get asked for help frequently, partly because of this show. What they did that I loved, they had specific questions. They had researched my background. They wanted something out of the conversation, and they brought something to the conversation, and they pitched their idea so elegantly and so inspiringly that I was like, of course I want to help this company because it deserves to succeed. And if you can't do that for your business, forget me because I'm just a guy. You're not going to get money for it. And they're proof that if you do it right, you will get money. And the kind of traction they've generated in such a short time is amazing. So tell us exactly what Ruth Health does and what it will do in 2 and 3 years from now.
Yeah, thanks, Nick. That's very kind. And honestly,
We studied heal.com
yeah,
so much before we
your
met
model
you.
convinced us that our model was possible. All of this is ironic now because due to COVID raging, due to then the Delta variant becoming a thing, our house calls have basically been put on the back burner, but we may bring them back someday. So today, Ruth Health is the telehealth clinic for pregnancy. And we treat pregnant people for a couple of specific things. We're pretty focused at this moment, it's November of 2021, on postpartum, because postpartum women in America are severely underserved.
They're not served at all.
Yeah, right?
Yep.
Like you get this, Renee, like all women in America, probably got one postpartum visit 6 weeks after giving birth times 3.
Yep.
One visit, 15 minutes. That's not enough time to say, I'm incontinent. It hurts to have sex.
Yeah.
I'm having lactation issues. I don't feel good in my body. There's a litany of issues that crop up after this huge moment of your life that is birth. So we developed pelvic training and recovery, which is a 30-minute sort of telehealth fitness session inspired by pelvic floor physical therapy to treat the 83% of
Right.
women. So that's 4 out of 5 women
Right.
experience some kind of pelvic floor prolapse after giving birth.
Right.
So
And
that
sometimes
means-
it's really bad that it actually literally hangs out, and
Right.
that's something that a lot of women take as
Right.
normal.
Third degree
Yeah.
prolapse. Your
Right.
cervix is hanging outside your body. And we have patients who've come to us, they fill out the onboarding questionnaire. We ask if you have prolapse, if you have pelvic floor disorder. They say no, and then we go through questions. Our amazing head of pelvic training and birth work, Kimberly, will ask them questions before they start doing exercises. And one patient in particular said, I think my vagina was disfigured.
Yeah.
I think the birth of my 3-year-old, this was 3 years
Right.
later. She said, I think something happened I've never looked or felt the same. After a few questions, we discover that it's prolapse.
Yes.
She has severe pelvic floor prolapse.
Right.
This is a condition that just
Yes.
doesn't get treated or diagnosed
Right.
enough, and it's typically not covered by insurance. So a lot of what we're offering right now, we're about to launch C-section recovery, which is another sort of fitness-based product, and then virtual lactation support.
Yep.
So these are things that almost every birthing person experiences. They have to deal with lactation, whether or not they breastfeed. They have to deal with their pelvic floor, whether or not they experience prolapse. And we're just trying to make pregnancy a less frustrating thing and
Yeah.
recovery from birth an easier thing that can pop onto your calendar and into
Right.
your life.
Well, it should be a basic right.
Right.
Countries like the UK and France, all of this stuff is a given
Yeah.
that it's covered.
Even
And we're so far behind.
even lactation consulting, and people like, imagine, for the guys listening to this, imagine that a part of your body was hanging out and you weren't able to have sex, and this was not covered as part of your health care. There'd literally be war. Okay. So this is such an important part of health. And I've said this to you both before, I don't even like the term femtech, because I love my kids and men want to have kids too, right? And men want to love their kids, and we're all human beings and we're all in this together. But it's sort of put in this category that is thought of as second tier or third tier to core health issues. And I can't think of a more important health issue. So tell me, where do you want to be in 3 years? 3 years, 5 year time frame.
Well, so
Where does
you
this get when you succeed? And there's no doubt you will.
Yeah, we have big dreams, Nick. But it's funny you mentioned the term femtech. In 3 years, we've transcended the word femtech, and there's reasons to use that. We are frustrated by it. First of all, not everyone with a vagina identifies as female or
Right.
feminine. That's why we say pregnant people,
Right.
birthing people, and we've gotten tons of flack for that, which is just ridiculous. But really, in 3 years, we are a destination for femtech. We are
There you
technology
go.
and support and services for your family. We're already moving into that space as we start to offer Ruth Health as a benefit through employers,
Yes.
right? We were shocked to find out that a 2-state company with 80% male employees wanted to offer Ruth Health as a
Yes.
benefit for those employees. That's not femtech, right?
Yeah.
Because it's actually male employees
Yes.
who are engaging our services and then offering it to a spouse, a partner, a dependent.
Yep.
So we'll go beyond postpartum. We'll be in prenatal. We may even be in pediatrics, but we really plan to use the next 2 years to scale evidence-based care and then to start impacting the factors that result in maternal mortality and severe maternal
Right.
morbidity.
Right.
So gestational diabetes, using centering pregnancy as a methodology, starting to use
Care
biometric tracking, and then we're
Care
really
matching.
excited about care matching.
Right. Well, look, here's what I will say. And I will ask you a last question, right? And then a short answer to a last question. And if you don't want to answer, because it is a political question in nature, but you're strong, powerful people, and I will certainly give my answer to this after you both do. Does Roe get overturned next year? Does the Supreme Court overturn Roe?
I'm really scared.
This is a tough question, Nick. We have a dearly beloved advisor at Roe, so we're not going to throw her under the bus.
No, Roe versus Wade, not
Roe v. Wade.
Roe v. Wade, not Roe Health. Sorry.
Health company.
Yes,
Does Roe v. overturn?
yes,
Well, listen, we named Ruth Health the night that Ruth Bader Ginsburg died.
yeah. Well, that is.
So you know where we
I was
stand
going to
there.
ask. Yes. Okay.
We're in peril.
Yes.
Yeah, we're no, it's terrifying, and so this makes us want to work even harder
Yes.
because I think the most effective are going to be the most underserved,
Yes.
and we want to make Ruth Health available to the Medicaid population. It's
Yes.
very, very important to us, and that's where we see ourselves also in 3 years is being able to offer the service to everybody. And there's a lot of nuances in it, but we're the United
Yeah.
Healthcare Powered by TechStars Accelerator for this particular
Yep.
reason is to access larger patient populations because Roe v. Wade, if that's going to really just affect people who are on Medicaid,
Yep.
and
Over 50% of births are on it.
Yes,
yeah,
yes, they
If
absolutely
Roe,
are. And here's what I'll say on this question, and then we'll wind up, which is I actually think Roe v. Wade it will survive these current two challenges, the Texas and the I think it's Mississippi challenges. I actually watched some of the arguments. I think we're going to be okay, but it shouldn't have to come to this. And there is no such, and I love the term famtech. You should trademark it, right? You should because it will be a
not
thing.
the first to use it.
And
It's not original, but
yes. Oh,
I
you're
mean,
not.
listen,
Well, so you're the first I heard it from. And I will say this to all the listeners. If you hadn't heard of Audrey and Allison, you will. They're going to be an important force in changing healthcare for the better. It's been an incredible honor to speak with both of you. You can see details about their company, and I encourage you to in the links below in the podcast. Thank you for listening. Thank you for being on the program, and great to have
thank you,
you.
Nick.
Thank you.
Thank you.